Hello everyone, I hope you're joining us today on Apollo 24/7's Health Hour. In today's episode, we're going to talk about some common urological issues. Joining us at 11 a.m. is Apollo's expert urologist, Dr. Samiran Das Adhikary from Apollo Hospital's Bhubaneswar. So join us in the live session and ask all your questions about urological conditions. It can be a simple urinary tract infection to bladder infections to stress incontinence. Go ahead and ask all your questions in the live session. See you there 11 a.m. sharp.
It's always been there, standing between you and your health. A wall. Between a pain that won't disappear and a doctor who magically appears. Between a long wait on a hospital bench and staying right where you are, at home. Between finding yourself out of medicines and finding them at your doorstep, whatever the time. Between years of health records all over the place and all your records in one organized access from anywhere place. Between your current regimen and the recommended routine. The wall. We don't need it anymore. Say hello to Apollo 24/7. This is India's largest end-to-end omni-channel healthcare ecosystem, designed to touch more lives than ever before and delivering its promise in 3 important ways. 1. Listen. Talk to us anytime from anywhere. We've got 7,000 doctors and 30,000 healthcare professionals listening. 2. Advise. We'll give you expert advice you can rely on, because it comes from India's #1 healthcare provider. 3. Assist. We bring you India's largest health network of pharmacies, clinics, hospitals and health insurance experts. 20 million people already trust us for their care, and a further 50,000 people are discovering this every day. Apollo 24/7. Expertise is for everyone.
Namaskar and welcome to Apollo 24/7's Health Hour, a show which shows us light when there is darkness all around, a show which has continued to give us information and which has been bringing experts every week, week after week, to you to understand what a condition is and to decide when to meet an expert, to let you ask your question which has been persistent for a very long time where you didn't find an answer. Here we bring you experts every week. And this week we are going to talk about urological conditions, causes and treatments. Dr. Samiran Das Adhikary from Apollo Hospital's Bhubaneswar is going to join us very shortly. So before we start the show, let me also tell you on the show that we have a health quiz where you can win prizes from Apollo 24/7. And I urge you to download Apollo 24/7, an app which brings entire Apollo hospitals into your hand. The power of finding medicines, booking tests, consulting doctors and everything that you can think of is into one app, and I'm experiencing immense benefits from Apollo 24/7. I urge you also to download the app and get benefits. Alright, so moving on today's show, I'm going to wait for your questions. I see that YouTube already is buzzing with questions. Go ahead, type your questions in the chat box and we shall take up your questions and we shall see that your question is answered. All right. So before we start, here's free pediatric consults for every child in need, a wonderful initiative from Apollo Foundation in association with Apollo 247. This is a mission to make quality healthcare accessible to underprivileged children at no cost. More than 10 plus pediatric specialties from who are renowned Apollo pediatricians are available, which is a great benefit for children across India. If you know somebody who requires this kind of pediatric consultation, free pediatric consultation, in fact, scan the QR code which is on the screen, or there's a link in the description box. Please do forward it to people who require it. All right, let's also find ourselves taking care of ourselves. See, pandemic has not yet done. We are still going through waves and rounds of COVID-19. Now that we are all surrounded, every home has literally every home is suffering from one issue, and I am now recovering from COVID, but I have made sure that all in one COVID care 19 care spot has come in real handy for me. There are self-test kits, there is a risk assessment, COVID-19 care essentials at best prices, an RT-PCR test with the same day reports, and one tab doctor consultation for any COVID-19 queries. This is exactly what you want if you are stuck with the virus. So all in one COVID-19 care spot is something that Polo 247 has come up with. You can find this, the landing page link is given in the chat box. Please go ahead and find it if you require, and do spread this because this is the need of the hour. Let's start today's show. I am going to introduce you to the doctor. We're going to talk about urological conditions, causes and treatments. Inviting our guest of the day, Dr. Samiran Das Adhikary, Senior Consultant Urologist at Apollo Hospitals, Bhubaneswar. He is a great expert with more than 21 years of experience in the field of urology, special interest in helping patients through issues of uro-oncology, laparoscopic urology and endourology. He served as an associate professor in the Department of Urology at CMC Vellore, received Best Reviewer Award from Indian Journal of Urology, received training in DNB Award, DNB Urology, and also is a DNB examiner, a peer reviewer for many national and international journals, an author of several publications in international and national journals. It's an honor to have Dr. Samiran Das Adhikary. Namaste, doctor. Welcome to the show.
Pranam. Thank you.
Thank you
Namaste,
so much
Jansi.
for joining us on this Sunday morning.
Thank you, Jansi, for the nice introduction. And I wish everybody safe to remain safe and to safeguard themselves.
Yes,
Yeah.
doctor. Yes, very, very important right now. Doctor, today's topic is very important. Lot of us tend to ignore because we think that urine is the last thing to talk about, or urinary health is something that, especially women, we don't talk about it. So ask me how many women I know who suffer from urinary tract infections and then continuous infections. Let me understand what a simple urinary tract infection is. What is an infection, first point?
Infection to urinary tract is very common. It happens from since infancy to our elderly persons, and this remains almost similar percentage when it is infant. Then again it is adolescence. In infant time, males are more prone. Then in adolescent, females are more prone, and above 45 or 50, again the females they get more prone, and above 60 again males are getting more prone to the infection means it is the inflammatory process or bacterial infection to the urinary tract. Mostly it is ascending means it happens through our urethra, because urethra and the urethra and the rectum is very nearby in the females, and urethra is very short, around 4 to 5 centimeter. The ascending infections are very common. So in a lifetime, at least 50% risk you have as a female to get an infection. 50%. So
Oh,
it can be
that
in
is high.
pregnancy, it can be, yes, it's a very high number. And in adolescence and marriage, sex, all that actually predisposes you to more towards this condition.
Correct.
So
So, female. female and male, there is a difference between a urinary tract infection then.
Yes, yes. The beauty of this is actually naturally you get this infection in female. Most of the time, we consider female infections are uncomplicated and can be treated within 2 to 3 days. Even one tablet can actually take you 80%, 90% cure. So it is easy to treat. The male infections are usually complicated and usually treated in longer duration, and it requires much more intervention. Usually, we say if there is any structural or anatomical problems associated with the infection, then it is a complicated. That means either structural anatomy, or there is a stone tumor, or there is a physiological the functional abnormality, like we are not able to empty the bladder completely. Then these are how we call it complicated UTI. That means it requires more intensive therapy and more longer duration of therapy. So those cases who have a structural or functional abnormality, they need to be on these drugs for longer time. They might get again and again. We see many people, they suffer to the recurrent infection, like they got an infection, got treated, again they get it. So we
Correct.
define it: if it is more than 2 times in 6 months, it is recurrent. If it is more than 3 times in a year, it is recurrent. And especially post menopausal lady,
Right.
they get, once they naturally more prone to get infection, then they get it again and again.
Okay.
So
So, and understanding that this is a very simple thing that we have to be aware of, and अगर ये
it is
avoid कर सकते हैं, prevent
it
कर सकते हैं, तो कैसे कर सकते हैं?
it is simple, same time it can be difficult, and it can be difficult to manage also. As you said rightly that sometime our habits, the personal habits, can actually prevent this problem or prevent the recurrence. Like common scenario I get to see in women mainly. From childhood they go to school, the girls, they go to school, they are being socially taught, or social upbringing or family upbringing, they never use the toilet in the school. So they hold the
Correct.
urine 6 hours, 8 hours, they come back and then empty the bladder at home. If you are traveling by air, you are traveling through the long distance, you are going to temple or going to do something, somebody visiting somebody's house, you not using the washrooms or toilet, so you are holding on urine. Imagine a bladder is not a mechanical device. If you inflate it too big, like a balloon, you imagine, if you inflate it too big size, it will, when you deflate it, it will definitely not come back to near size, normal size. So it will return water or urine. So that means you have leftover urine after you are completing urination. That means you are likely to get infection. If you have got an infection, then you're likely to get more complicated because it's not completely emptying. So I would say, whenever you get an opportunity, whenever you feel like passing urine, you must use the washroom or toilet, even whatever condition it may be. It is not the condition of the toilet which causing your infection, it is the infection inside with us. The commonly
Right.
seen bacteria, Klebsiella, and E. coli or Pseudomonas, these are all our own bacteria harboring in our rectum or anal canal area. It is in the stool actually. They are coming to us as a ascending infection. They are not coming from our toilet. Many people have a belief that my toilet was dirty, it was a public toilet, I used and then I got it. If you ask, if you retrospect yourself, you traveled through say Delhi, and 5 hours you could not void, you didn't get an opportunity to pass urine, and then you use the toilet maybe somewhere else. Then you blame that, okay, I used the public toilet, that's why I got it. It's not. You actually hold urine for longer time, you inflated your bladder to be full, and you could not pass urine completely. It can happen to males also. Like I travel overnight bus, and I didn't get any opportunity to pass urine. 5 6 hours I have to hold the urine. Then I did the same thing what people are doing. So I would say regular emptying of bladder, one, that is 2 to 3 hourly. Remind yourself, go to toilet or washroom. Never binge with water, like too much water at a time, then not taking water. So frequent interval you
Oh,
take water.
well, that is what I wanted to ask. That is something that I've
Maximum.
been holding to ask. Like, if I need to empty my bladder frequently, according to what you said, then do I need to drink more water? Nowadays, I see
Yes,
everybody talking about,
I, I,
drink
I
water, drink water.
I actually warn my patients that usually normal person, normal human being won't need more than 1.5 liter a day. If I take somewhere 700, 800 ml also is good enough. So if I consider my all food, say around 2.5 liters or kilo per day, most of the food has a water content. Even the dry fruit has got a 50% water, rice is having 90% water. So every food has a water. So food itself is giving us enough liquid. Above that, you drink need to take something if a thirst is there. Now the thirst is artificially created. Like my social bringing, my family bringing up me. My mother said, my grandmother said, you have to drink lot of water. I take 8 liters, 6 liters. That is not enough. That is not good. I would say 1.5 liter. That is 5 to 6 glass of water is good enough. And with that, your holding capacity of bladder is 2 hours, 2.5 hours, 3 hours. You go and empty your bladder. Avoid constipation. Usually constipated people they get more of infection, so your bowel disorder can actually give more infection to the urinary tract. So if you avoid constipation, then that is mostly prevented. Good personal hygiene is required. That doesn't mean that you have to use a lot of chemicals, liquid soap or soap to clean yourself. It's just water is good enough. So emptying your bladder regularly, and then personal hygiene. These are important steps to prevent recurrence or getting into UTI.
Done. So, as you're talking about, frequent urination, we have to relieve ourselves. But I also
I
feel
mean,
that frequent urination is a problem in a lot of elderly, that they find themselves urinating frequently. Is that a problem?
frequent urination means we are actually in a day 5 to 6 times we void. Say if I have to empty 2 liters of urine, and most of the time it's 150 to 200 ml my bladder capacity. Say hardly 8 to 10 times is good enough. So in the daytime 6 to 8 times is good enough. In the night we consider getting up once is okay, but more than one is not okay. So frequent doesn't mean that you are holding urine longer time than 5 to 6 hours. I mean that 2 to 3 hours interval is good enough. If you are not doing that, then you must visit washroom within 3 hours time. That is what I meant. The elderly people, there are multi-factor which works for our frequency. Like the bladder capacity also goes down. In females, the hormonal changes like postmenopausal lady, lack of estrogen, the dryness of the urethra and the introitus area, that also causes the difficulty in passing urine. Then in males, prostate problem or prostate related other problems also can cause outlet obstruction, which also can cause frequency. So in age people, it can be different. It is a multiple, and sometime in elderly we see when you lie down, your cardiac output is more, your urine output is more. Like whether you are taking a nap in the afternoon or the night, you are likely to get more urine formed in your body. So then you are
Oh.
passing. So you get up in the night 2 to 3 times. Your sleep get disturbed. Some people sleep pattern is not good. So once they get up, they cannot sleep back again. So they keep on visiting washroom or toilet. So that is how the added problems goes on. Like females, elderly female, as you said, many of you are known to are having problem. Many people don't come to us telling about the urinary incontinence, and I'm sure it is more than the prevalence is more than 40% in elderly age group. Many people they think it is part of my aging process. My mother was suffering, my elder sister was suffering, so I am also bound to suffer. It is not necessarily. Many a times we can give a cure to these people or help them to reduce their problem, because when
Okay.
you have
So Priyanka is asking a question here. The same thing, doctor. I'm sorry to interrupt you. Her question is 55-year-old male, urination during the night one time and urge before urination. Is this common?
Yes, if 55-year-old male person, the prostate problem are likely. The initial symptoms are actually frequency or not able to completely pass urine, incomplete emptying sensation. These are the common symptoms. But when these are delayed symptoms, then the urgency, like you have to rush to the toilet. Otherwise you might actually dribble or might leak. Though leak happens much later, but before that this urgency happens. And sometimes if we add it with the diabetes or any other neurological condition like Parkinson's, you can have it more. So he need to see a urologist nearby or in her city, and look at any of these issues are there, like diabetes, neurological ailments, or spinal cord problem, or prostate problem. For that, little bit of evaluation is required. But many times, as I said, if you practice less water intake, like 1.5 liter, avoid constipation, 70% problem will be reduced.
Done. Sir, as you're talking about diabetes, Deepali Mute is asking, I want to discuss my husband's issue who is suffering from diabetes and he is also suffering from urine related issues. So, is diabetes directly linked to urinary or urological conditions, doctor?
Yes, yes. When your sugars are high, the commonest symptom to diagnose diabetes is actually called polydipsia polyuria. Means you feel thirsty, you take more water,
Frequent.
and going to pass urine more time. So that is how we suspect could be diabetes. That is how we start with. When our concentration of sugar in our blood is more, you are getting more sugars in the urine also, and the volume needed actually to dilute it is actually required. That's why polydipsia and polyuria. That is how it happens. So if sugars are controlled, even then also he has this problem. Then condition I mentioned before, it will be same. And in the diabetes, long term, like more than 10 years of diabetes, you get peripheral neuropathy. The nerves also get affected. When that happens, we call lower motor type of damage to the bladder. So there also we get a problem like diabetic cystopathy, where we cannot empty our bladder completely. So when where
Okay.
we cannot bladder completely, then little bit of a deposit of urine, if you are passing again, say your volume is 150 or 200 ml, you are not able to avoid at least 50 ml is leaving by. So another 100 ml you have to pass urine. So your frequency increases, and the urgency also increases of the neurological dysfunction. That is also possible. So he needs
Done.
to see
Next
first.
question, something. Sorry, doctor. Yeah. Next
He needs
question
to
is from
see
Mr. Gaja
diabetes.
Pandi. Sorry, I
Yeah.
think I am overlapping
Yeah.
you.
Yes, go
Please
ahead.
continue your answer.
No, I mean to say diabetes, sugar control look to be looked at first. If after sugar control the urine problem is continuing, then needs to see a urologist and at least a ultrasound of that area. We call kidney ureter bladder ultrasound KUB, which gives us a good finding about how much urine is left behind and what is the prostate size. Then we can guide the treatment. Most of the urologists would be able to help. Yeah,
Okay,
next
so
question.
Gaja Pandi's question is next. Sir, 43-year-old male hai, have BPH with residual volume 90 ml. How do I reduce my residual urine? This is what you were telling right now.
Yes, though he has not mentioned about the size of the prostate. If BPH means benign prostatic hyperplasia, which is the commonest condition in elderly male, and prostate happens to male only, and the with age, the size of the prostate increases, and when it increases beyond 30 gram, usually the risk of retention is high, and you the initial symptoms are usually not able to empty completely, incomplete emptying of the bladder. That is always happens. So 90 ml is actually high. He would require some treatment of prostate, and then we have to follow up with ultrasound with the drugs. And if that is reducing in the volume, then it is good for him. And same time, as I mentioned, less water intake like 1.5 liter, and regular emptying of bladder is important. Avoiding constipation is important. These three things will help him at least 70% time.
So I am now looking at the YouTube questions. More than 600 questions, more than 600 people have joined us, and then a lot of questions. So let me club the questions and give you, sir. Frequent
Sure.
urination is something that I'm seeing a lot of people are asking about frequent urination. And how to get, Johnny asking the same question. So a lot of them. How
Yeah,
do we
the
address this?
question answers are given beforehand actually. All these questions answered beforehand. I would say a little bit of lifestyle modification. Like many a times we are having sedentary lifestyle, and sedentary lifestyle means we take a lot of water and tea, coffee, beverages. So then we push our system to have more urine, more liquid intake, and more urine. If the younger population and elderly also can be doing the same. I usually say the tea and the caffeine, both caffeine and the tea, both are diuretic. They cause actually more urine formation. and we are most of the time under air conditioned system, like temperature keeping low than 25 degree, or usually we are increasing our basal metabolic rate. That means the side product, any organic our reaction happens in our body, the side product is water, H2O. So in body indigenously also produces more water. So all the time we are actually keeping ourselves stressed with this environment. So I would say reduce water intake to 1.5 liter, tea, coffee to 1 cup a day, beverages as minimum as possible, cold drinks avoid, and keeping your temperature in the ambient temperature above 25 degree would reduce these problems mostly 80 to 90% time. And beyond that, if you still have the problem of frequency like visiting toilet too many times, then you need to see a urologist nearby. Mostly we help them and able to help definitely, though no doubt in that.
Very practical tips, doctor. Rather than giving medications, you gave some nice practical tips. Thank you so much. And next question is from this is a female 36-year-old Rashmi Bhatt. Sir, I have mild interstitial cystitis.
Yes,
Can it be cured?
yes. Yes, Rasmi, this is interstitial cystitis is a diagnosis of exclusion. Like I am treating many other things and not helping, not able to help you. Then the doctor puts this diagnosis of interstitial cystitis. It is not very commonly seen, and most of the time in India we see TB as actual masked one. So if it is TB test has been not been done and to be done, the urine we send for acid fast bacilli A/B smear test, and usually 3 to 7 times we repeat. And if those tests are negative and you have it already diagnosed with the basis of biopsy interstitial cystitis, nowadays we are able to treat with certain chemicals we are getting, and that is will help you. But as I mentioned before, there are certain lifestyle modification would help you. Even the active physical life also would help you to overcome this situation. Like we are actually not getting into active physical life, so then also these pains and aches are more. And empty your bladder before you feel like passing urine. Usually it happens in interstitial cystitis while urine is accumulating in our body in the bladder. We usually don't recognize it. Once it is full, then only sensation comes. Then I use the washroom. In interstitial cystitis, while the urine is actually accumulating in the bladder, it's actually painful bladder syndrome. It is actually painful. So if it is truly interstitial cystitis and diagnosed by urologist and by a biopsy guided method, then the urologist would have given you prescription, and there are drugs which were not available few years ago. Now it is available in India, and it actually pentosan polysulfate actually we give, and that helps a lot of people, and anticholinergic and other drugs which can help. We keep on moderating the drug. Sometimes it is required more, sometimes required less. So you can moderate yourself.
Okay, so next question is Mr. Venkateshwara Vasireddy. Frequent UTIs, kidney swelling, 65-year-old aged male, diabetic and CABG 3 years back. What is my problem?
Uh, this is a difficult problem. As I mentioned, in males, it is usually a complicated UTI. Here, I would say it is a UTI and the diabetes together causing damage to his kidneys. And hydronephrosis is the hydronephrosis. That means usually what happens in diabetic, the medullary part, the end part of the kidney gets actually infected and necrosed. So that is called papilla, which actually get necrosed and dead. Then they get sloughed out and they come down to the ureter and block the ureter. We call ureteric obstruction due to papillary necrosis, and that is a serious diagnosis. If we are suspecting that, usually we diagnose with the CT scan. A non-contrast CT would guide us. We call CT KUB non-contrast. And if it is showing similar thing, then usually we put a stent or do a ureteronoscopy, remove the papilla. Then only this would settle. Otherwise, it won't settle. It is now for him. I have a feeling because of diabetic urinary tract infection, there is a papillary necrosis which is blocking the ureter. Above the ureter, from the kidney to the ureter, that urine is like infected urine or like a pus. So whatever amount of antibiotic we give, they won't reach to the dead tissue. They will reach to the viable tissue where blood is reaching. So definitely that has to be removed. So it requires a expert urologist intervention, and then it will be helped. Once you drain that kidney, most of the time they settle. But the
Now,
insult could be irregular. Yeah.
so Venkateshwara Garu, Dr. Samiran Das Adhikary Garu can be contacted on Apollo 247, and the link to his is also given. You can ask him for further details. So next question is, there are two questions about prostate issues. Mr. Rahul Kumar Jaina is asking, what is the risk factor of prostate issues after kidney transplant? And also I want to ask you about a prostate question. Suresh Dave, sir, I am suffering from prostate cancer and I have taken radiation and injections too, but I am still having burning sensation in urine. Two
I'll
different
go
questions,
one
but
by
I've put them
one.
together.
Two different questions. For the post-transplant patient, prostate problem happens when the age is in the prostate. The aging process remains same whether it is a transplant or no transplant. So usually 55 or 60 is, and then beyond you can have. So usually post-transplant patient, we keep them on regular follow-up. Regular follow-up means at least an ultrasound every 6 months or yearly, when we see the post void residue after you complete your urination, whatever urine is left behind, that is called post void residue. It is increasing in number, or prostate size is increasing. Sometimes they need a help from the prostate related medication, and they should be on a regular follow up, because they can get a UTI very commonly, and once they get a UTI, the kidney will be in trouble, and because they are immune compromised. To keep their kidneys healthy, we put them on immune suppression agents for life. So they need to be more careful than normal people. Coming to the prostate cancer person who had received the treatment of radical radiotherapy and hormonal agents as an injection, the problem he is facing are due to the treatment. The burning sensation now is because of the post radiation damage to the normal tissue, which is unavoidable. Some people get it more, some people get it less. Some people get it early post radiotherapy. Some people late post radiotherapy. If is early stage, like immediate 1 year or 2 years within that time frame, then it will usually settle. But those who get post radiotherapy 10 years or 15 years later, it's very difficult to, we call radiation cystitis. They are very difficult to manage. They are very complex situation actually. They are worsen over time. And but for him, again the same treatment as I mentioned, probably that will help him reduce water intake to 1 liter a day, not more than that, and empty your bladder before you get a sensation. These are two advice I would have. And then we have to look at how is outlet, like how is the urine flow, and what is the urine left behind in the bladder. Both will guide us the treatment.
So I
So hope
see a
this
lot of
question.
questions regarding prostate issues, doctor. Sirisha Chodankar, if a patient of 70 is suffering from prostate issues and consuming Silodal tablet, does he have to take the medicine for lifetime, or are there any other options? This is one. Also, Surya Rao, who is M6, male 61, PSA is 14, 4 months back, prostate biopsy conducted, nothing wrong found, using Maxovoid 8 and for 4 months now. Urgency in urination still continues. Advise what to do.
The prostate related issues, usually we give medication like what you have taken. This is having a two chemical in that, usually dutasteride and silodosin in that. That is silodal or maxport. Both are the similar drug, and they usually have the half life of less than 12 hours. So this effect would remain 20 to 24 hours. That means you need to take every day to continue to get the benefit. So you can't stop it. Some people try stopping it, some people take alternate day just because they are worried about the side effect. I'm rather worried about the today's problem, and today's problem should be sorted out. Then what will happen 1 year later or 2 days later, I don't mind that, because as a doctor, when I prescribe certain drug, every drug has got a side effect, and when we weigh between the advantage and disadvantage, then only we are able to prescribe. So whoever is prescribed, rightly prescribed, and please continue the drug up to the life, or up to the problem is not sorted out surgically, or your drug is not changed by your doctor. Don't do that discontinuation of drug yourself. and sometimes we modify the drug doses can be modified if are completely all right, but if are not symptomatically better, then better not to change anything, you just continue the same. Other question, second one, Jansi, the second question was about
The similar kind of questions,
PSA.
sir. Who's
No,
been,
it's a
yeah,
PSA. The PSA is an enigma for me also. As we had discussed before, and also the PSA, sometime no amount of PSA, like any value of PSA, like it is in the laboratory report, it says less than 4 is normal. For me, if it is less than 1, also there is a chance of carcinoma prostate, and less than 4, about 25% can harbor the malignancy, and so 14 we cannot categorically say whether he has a malignancy or no malignancy. Now once these thoughts are put into the patient's mind or relative's mind, the anxiety level goes up like malignancy. So it's very difficult to
correct.
deal with after this happens. So once the biopsy is done, then next what? Then the follow up usually I do. I put them on regular follow up. We do a PSA regularly, 3 to 6 monthly. Sometimes we do MP MRI of the prostate that guide us how is the lesions looking like, and sometimes PSMA PET, that is a PET scan specific to the prostate, which can be also guided. And these two guidance will help us whether he is really having the risk of CA prostate. Then we have a guided biopsy, we have a trust fusion biopsy, then we can actually locate the area and take a biopsy there. Even sometime we are not able to prove that, then we take a super saturation by, normally we take 16 core and we go to 32 core of biopsy. So it is a cumbersome process. It depends upon how much you want to chase in that area and look for it or don't look for it. Now beside that, this is not causing your urinary symptoms. This PSF 14 is not causing your urinary symptoms. This anxiety is causing your urinary symptoms, or you have somotor urinary symptom. Then urinary symptoms should be treated. For that, you have taken Maxpoid. The only problem with the Maxpoid, what when you take these drugs and the PSA, usually we say 4 to 6 months time, the PSA is considered as double. Like I am continuing this Maxpoid or the dutasteride tablet, and my PSA is 5. That means my normal PSA would have been actually 10 or more than 10. So you have to consider that way. If it 14 is after taking the drug, I consider his PSA to be 18.
Okay,
Sorry, 28, 28. So in that case, he needs to be evaluated completely with MRI and PSMA PET and guided biopsy. Right, Russ? So then only it is not
done.
a simple thing. Once it gets into a mind and body, it is not easy to take it off. For a urologist, also not possible many times.
Okay. So next question is Swati. I'm 33-year-old unmarried female suffering with urine leakage since a year, and all the urine test reports are normal. Doctor said it's because of stress and anxiety. Is there a possible cure?
Jhansi, this is a problem with many ladies. As I told you, they come up, sometimes they don't come up. If it is a continuous leak possibility there, then it is a different, anatomically different, disease is different. If it is occasionally happening or stress like happening, like stress means cough and this thing, or any abdominal weight lifting, or getting up from a position, if that is happening, then the muscles in the pelvic area are actually weak. Sometimes we say modification of the water intake, exercise, and we typically say Kegels exercise. Kegels exercise, you can
Kegels.
actually look at Kegels, yeah, in the videos of YouTube, or look at the photographs. That is actually to strengthen your pelvic floor muscles. That is very simple. It's like I will describe now within 10 seconds. Like as if you are feel like passing urine or stool, you need to hold. Then you just hold with your breath hold, and with that breath hold, you count slowly 1 to 10. You hold yourself, then 1, 2, like that up to 10, then release your breath, so that this contraction happens and relaxation. So for that you don't need to yoga and other things, or you can be actually watching TV, you can do yourself, you are doing your work, you can do yourself, but it has to be done continuously in thousands and thousands in number, so that this improved technique would help her to deal with the incontinence. But incontinence, if it is a continuous form, especially young individual, young females, then we consider it is an anatomical problem. It is a we call ectopic ureters. Ureters coming down below the urethral meatus or internal bladder neck area. Then you have a continuous urinary leak. Your underwear and other things will be leaking and stinking. That is requires evaluation completely to look at whether it's an anatomical problem. If it is not an anatomical problem, it will settle 90% time what I mentioned.
Wonderful, doctor. Doctor, next two questions are from a female and a male who are under 30. Sharmishna Saha is 27-year-old female. I've got my stenosis done but still facing retention issue. Please help. And then next is a male 23-year-old Prashant. I got a test like cytoscopy but everything is normal. There is no sugar but my urine is still retaining. It is very disturbing at a very young age. So both
These two
female
are
and a male.
These two are very difficult problem as far as I am concerned. First thing is the urologist who have seen has to taken into confidence that what exactly these patients are facing. We call dysfunctional elimination syndrome. Like our voiding and passing motion both can be abnormal, both cannot may not be physiologically normal. If these patients are treated wrongly with dilatation cystoscopy, then they believe this helps in the outlet or emptying your bladder or bowel. That usually doesn't happen. These are actually pelvic floor disorders, and sometimes their anxiety, their stress has to be taken care of. They usually get better. But stenosis in 37 or 27-year-old, it is a
27.
impossible. It is impossible diagnosis. It is not true. It is a man-made stenosis. Sometimes it is because I'm not able to pass urine. I'm retaining some urine in my bladder. I've come to the doctor, and doctor fortunately, unfortunately, misdiagnosed it to be a stenosis and dilated the urethra. Then we cause injury to the urethra, and then gradual dilation 2, 3 times, 5 times. You can get stenosis of the urethra. But normally, urethral stenosis are not seen at all at this age group. Even for the male person getting a cystoscopy done, also I am little scared about it. He might have to look at his neurological function. Usually I evaluate completely neurologically, like how is their bowel habit, how is their bladder habit, how is the lower motor functions, sometimes spine to be checked, and sometimes we have a occult spine abnormalities. Then I do a MR to check the spine neurologically. These issues are absolutely normal. We do aerodynamic study. That is, aerodynamic study means we measure the pressure inside the bladder. We look at how is the pressure inside the bladder. If it is pressures are according to the pressure, if it is high, we take care differently. If it is normal, then it's okay. If it is subnormal, then we need to treat differently. But mostly to me, it is a difficult situation. It should be dealt with an expert urologist who understand this problem. Otherwise, you will be falsely termed as urethral stenosis or urethral stricture, and you have to suffer through the life. I have a feeling if those patients can be taken care of by an expert urologist, they should come back to near normal.
Okay. Two quick questions. One is a 62-year-old Gauranga Behra. I'm taking Dutalfa Combi Pack for 3 years, more than 3 years. PSA is 0.187 now. Whether I should continue or not?
PSA is the norm marker for the either treatment or the medication. So I don't know how he got into this PSA. If his PSA is zero point 0.1 and without any previous high PSA, he need not bother. He need not repeat this test first. First warning. And second, I have explained already. These drugs work less than 24 hours, so he needs to be continued. If he has been prescribed duly, he should continue for life as long as he is doing all right. If he's with the medication, it is not doing all right, then he needs to come back to urologist to for the next course of the treatment. But there is no relation for the treatment and the PSA. Sometime I told you that the dutasteride causes making it half, so that
Okay.
gives a false belief that okay, my PSA is coming down. There's no meaning of doing that PSA or continuing the test also.
Thank you so much, sir. Lekha is asking, can you please ask this question to doctor? It's very important for my dad, and he's 51-year-old. He's suffering from frequent pain in the left side of abdomen region what is the cause, and also have a urinary problem.
At this age, I find two problems are common. In younger age, I usually go for a ultrasound to look at stone and other things. But at this age, the ultrasound would be required of his prostate problem. But I have a feeling my this thing says कि we look at his spine and the spinal cord as with the MRI and look at those things are making issue for his pain. If it is normally we do ultrasound and it doesn't give any clue, then there is nothing we can do and say no, no, your pain is like this, back pain. But before we say back pain, sometimes specific back pain like this or pain in the abdomen, we when the nerve is compressed in certain level, the area it's sensation it takes, you get the sensation there. So a nerve at level of L4, L5, or L2, L3 are actually will cause pain to this area, and then you will feel, yeah, I'm having a severe abdominal pain, but actually problem in the nerve in the back. So that way, I would say for this age, I would do a MRI of the spine and look at his nerves first, and same time a ultrasound of prostate and look at his bladder issues. And if any clue comes, then treatment could be possible.
Done. The next question is a very interesting observation that we keep tending to listen to our social media and internet and lot of other sources. So Pulkit Agarwal is asking, some internet write-ups say that male who ejaculates less has high risk of prostate cancer. Is this true? And I also want you to advise on how much do we trust the internet?
uh, I am aware of studies like this, and as I mentioned, if you are a active physical life, most of the time activity is actually obesity is established to see a prostate. But ejaculation part, some people have tried to look at, but it's not conclusive evidence that less of ejaculation having our prostate problem is avoided. That is not a proven one. But obesity, yes, obesity. More the obese people, they are linked to severe prostate risk high. So I would say active physical life are most important for a male hormone balance, and hormonal balance actually prevents your prostate cancer. It is not that anything like this would actually prevent. So these are anecdotal studies, they are not reproduced by anybody else. So I would say don't go which suits us, we take that from the net, which is not correct probably, because in the social media, especially WhatsApp universities, we get we push our views which we would like to listen to or wish to listen to. Then we try to believe that, because if an astrologer says none of your friends and family members and girlfriends are believing you, you would probably believe that this astrologer is the best one in the world, and that is not true because it suits your psychology. So I won't say that basis on this you practice remain normal and healthy. Normal and healthy is a normal physical life, normal active life is good enough. So anything abnormal, anything doing extra or less are harmful. That is the basic simple teaching for us.
Okay. So next question is
Many
Sham Sundar Singh. Some doctors suggested me to drink a lot of water, at least 3 to 4 liters a day, as a remedy for kidney stones. Please suggest what is the optimum quantity of water for removing stones.
Coming to the literature on this is the only literature we have for the stone disease, preventing stone disease. And there to suggest if people who are maintaining the output, urine output more than 2 liters, they can prevent stones. So that is why I'm coming to this conclusion. If I take 2 to 2.5 liters of water a day, my urine output will be from 2 liters to 2.5 liters. So that is good enough. So doing more than that probably is not necessary. It has been seen something when this study was done over 200 odd patients, they given all sort of level of therapy, and they found this is optimum. 2.5 liter is good enough. So don't go beyond that, because taking more also is not helpful for your stone disease. Neither water dissolve the stone, so that is not having any scientific basis. So we usually say 1.5 to 2 liter with normal intake. So for the stone disease, you can add another 500 ml. So 2.5 liters is good enough. Rather than that, what actually we know as a scientific community for the stone disease, because mostly stone formation and the why the stone formation is enigma to the science now, still now. But we know there are extra salt like preserved food. Any packaged food are actually having preservatives, mostly are salt, and high protein diet like red meat. These two changes our pH, changes our chemicals in the urine, so the supersaturation is common, and you can have stone disease. That is how when it is prevented, then the stone recurrence comes down. As such, the stone recurrence is 10% per year. So within 10 years, you will have 100%. First 2 years risk is about 50%. That means those who have a stone, they're likely to get stone again and again. So try
Oh,
to modify your lifestyle. Try to modify your lifestyle, and especially those who are actually taking packaged food like these chips, kurkure, and all that, the salty foods. To avoid cold drinks, to avoid red meat, to avoid. These are the things I would suggest. Water intake around 2.5 liters is good enough. Not more, not
okay.
less. For
So,
the specifically stone disease.
continuation in the same question, sir. Nagesh is asking, I'm suffering from a right side kidney stone, 5.7 mm. How will this come out? What are the new procedures?
Usually, to my philosophy, younger the individual, the higher the risk of recurrence. And those stones which is not cause any trouble, usually I don't touch them, because even I clear them. I have procedures to clear them. We call retrograde intestinal surgery (RIRS). Through RIRS, we can take out the stone, but it won't prevent the next stone forming. So this stone is not causing, unless you are a high precision industry or high precision job like a pilot or a sailor which is going out of the medical facility for a long time, or in an army. Then those are the patients, we say that you clear your stone. Otherwise, you wait for the symptom. Nowadays, this facility is available everywhere in all over the India. So you don't need to worry. Whenever this stone drops, you will get a pain, and if pain is severe one, you may need to see a urologist. We'll take care then and there. It takes within 1 day, you will be getting cured. And no
Done.
treatment is there to dissolve the stone. No treatment is there to dissolve the stone. You must understand that. So those who are actually giving any prescription for that, I won't suggest that.
Great. Doctor, the time, we're running short of time, so I would want to put two important questions briefly if you can answer. One is Archana saying, sir, my CS urine sample, everything is sensitive or higher than the reference zone. I'm getting a low amount of urine or only urge to urination. Can we plan baby during this infection period? That is one. And how long it will take to cure UTI in a diabetes person? My father is suffering from 1 month with frequent fever. And could you please advise? This is Nikita Nanda. There are two
Very
different
important.
questions.
Yes, I understood. Very important question is the first one. The female planning for a conceiving and getting a UTI. If it is a symptomatic UTI, that needs to be treated. UTI is the major cause for miscarriage, and even the conceiving problem can happen. And sometimes the drug used for the treatment of the urinary infection can be harmful for the initial time of the baby formation. So you need to be very careful. There are certain drugs are not used, certain drugs are used. So your gynecologist or urologist should advise on that, and how you will do with the pregnancy, duration of the pregnancy, during the pregnancy, that also to be guided. Those who are likely to get infection, they are high risk candidate for the pregnancy. And if it is sensitive, if she is symptomatic, she needs to be evaluated anatomical abnormalities, any ultrasound problems, then it need to be treated. And treatment usually done, if they are in the verge of planning, then they need to be cautious about choosing the antibiotic also. Usually penicillin or cephalosporin group antibiotics are better and safer, and that can be continued over the pregnancy safely. But certain other drugs are dangerous. They are teratogenic. They can have problem in the organ formation of the baby. So need to be very careful. Then second question is the diabetic person having recurrent UTI are dangerous. As I mentioned beforehand, if somebody listen to, I usually very extensively evaluate them. I look at their urine culture, their blood culture. We do a CT and look at whether there is an abscess there, whether ureteric obstructions are there, whether prostate problems are there. We need to address very intensively. Otherwise, this will be a continuous problem. It may not settle. Even after doing all that, some people they don't get better because, as I mentioned, there are micro abscesses forms in the kidney or prostate. Any antibiotic which is given are going through the blood vessels. If blood is reaching that part, then only the antibiotic can work. Otherwise, not. So, a micro abscess, that is a dead tissue. So the bacteria is harboring there. Whenever your immunity is low, as such, they are immune compromised. The diabetic people are actually low on the immunity. So whenever immunity is low because of stress, because of high sugar, because of other problems or corona, then they get into this infection again and again. So it's difficult. But still, we usually try to help them with extensive treatment, like evaluating them completely and addressing the if there is an issue.
Okay, so last two questions, quick answers. Is prostate cancer hereditary? One, Kapil has asked. And Manish Lodha, is prostate surgery beneficial if the bladder has become very weak after doing the urodynamic test for my 70-year-old father whose CABG was done 9 years back and also a diabetic?
The first question answer is there are literature evidence about it being hereditary, especially when your siblings, like brothers or the father, having this history, they are likely to get more, and that usually seen in blacks and even our country also. So usually PSA recommendations are taken up from many areas, but this is one area where if a known father is having severe prostate or elder brother is having severe prostate, they need to be followed up with a urologist, a digital rectal examination, and PSM test every 6 monthly or yearly above 50 years of age, and it has to be continued. And the risk is definitely higher. And for the other condition, I would say they need to see a doctor, a urologist, for his father problem. And the problem what at hand are difficult because diabetic, as I mentioned, can have a neuropathy and diabetic cystopathy, where the emptying of bladder, the pressure inside the bladder is created is less, so emptying is less. Sometime if prostate is very large and this is contributing some part of it, then prostate surgery sometimes helps them. If it is residue is 300 ml, if I do a prostate surgery, good outlet, this residue might be coming down to 100 ml or 50 ml, that might be help. But if the aerodynamic study is showing a very low pressure, then it is a difficult altogether. They need to have a emptying of catheter, a bladder with a catheter, or we give them an option of intermittent catheterization, so that you empty your bladder every 4 hourly. So these are the two options he has. If it is clearly
Right.
diagnosed diabetic cystopathy, very low dead pressure pressure on a urodynamic, I'm sure whoever is done the urodynamic and assessed by a urologist, they will be at a position to guide them. But if it is too low pressure, surgery can take, but very difficult to predict beforehand how much it is going to help.
Okay. Thank you so much, doctor. There are a lot of questions about catheter which I could not take up. There are a lot of questions about prostate, more and more questions about prostate. We shall definitely come back to you, and we understand that this is a very important topic that people are looking forward for advice. We shall come back to you more on exclusively prostate and other bladder issues,
Yeah,
doctor.
I thought
Thank you so
prostate
much.
is
And can we, yeah, can we have some top tips how to prevent urinary and prostate issues?
I would go. I would take one at least. Maybe my common thing would be they about our lifestyle, and that is avoid sedentary lifestyle. And water drinking should be around 1.5 liter a day, not more than that. Avoid constipation, and this would help in many ways, keeping ourselves healthy, whether young, elderly, whatever it is, for female, male, irrespective of whatever it is. So many a times because of these things only we get into trouble, and curing or giving treatment for that trouble is very difficult for us. So and then comes the aging process. We cannot modify the aging process. We just help to relieve some of the symptoms. Sometimes the aging process will continue. The more active you are, your aging process will be slow and delayed. The more sedentary you are, your aging process will be faster. That's what I can say.
Wonderful, doctor. Thank you so much for this wonderful, informative session. It was a great time spending with you this Sunday. Looking forward to having you once again with an interesting session. Thank you, Dr. Samiran Das Adhikary.
Thank you, Jansi. Thank you, the whole team, and thank you the all the patients and people who are anxious about this. I'm sure I would have helped them some way, and hope to meet them or catch up them on some time on a web or internet or chat. Thank you.
Thank you, sir. Thank you so much. So it was a very, very informative and useful session. Now we are going ahead with our health quiz. You can answer the questions over the chat. I'm going to ask you 3 questions. If you are declared the winner, your name will be announced towards the end of the show. And if you are, all the winners will be selected at the sole discretion of Apollo 24/7 team. Winners, if you are declared, you have to write back to us with your contact details at marketing@apollo247.com. Gift vouchers will be shared with you. Here are today's 3 questions. Question number 1 on your screen. Which liquid produced by liver helps to digest fats in the food that we eat? I repeat question number 1. Which liquid produced by liver helps to digest fats in the food that we eat? Question number 2. Which gland produces seminal fluid? Which gland produces seminal fluid? आज ये ग्लैंड के बारे में इतने सारे क्वेश्चंस आए थे, आंसर्स तो आप ही के क्वेश्चंस में भी है. Question number 3. Which feature on the Apollo 24/7 app allows you to book RT-PCR test? Question number 3. Which feature on the Apollo 24/7 app allows you to book RT-PCR test? These are the 3 questions for today, and you can answer. I'm waiting for the winners to be announced in a while. In the meanwhile, let us also talk about having a doctor, having a general physician online, consulting online in 15 minutes. It's very important with the kind of situations that we are all facing. Having an Apollo doctor consultation in just one tap, it is possible. You can book it right now. You can talk to a general physician online in just 15 minutes at rupees 249 only. You can book it right now. You can access it through apollo247.com. Apollo 247 as well. There's a link which is given in the description box as well. This is a great benefit in case you're looking for a general physician online. All right. Next is thank you so much all of you for joining us. Here are some coupon codes that you can use on apollo247.com or Apollo 247 app. Use HH247. This is a coupon where you get 199 rupees off on online consultation with Apollo doctors and up to 20% off on medicine orders as well. Thank you so much all of you, and by the way, the winners are here. The winners of today's quiz session are Bittu, Surendra Verma and Krishna Kumar Sharma. Congratulations. Please write back to us to claim your gifts. Thank you so much all of you. It was a great informative session today. Keep asking your questions because your question is answer to many. Next week, we are going to talk about skin and hair infections, the causes and treatments. Let's hear it from an Apollo expert. Tune into Health Hour, Sunday, 30th January, 11 a.m. You can also subscribe to our YouTube channel, and there's a bell icon which you can tap and there will be a reminder automatically. Don't miss this session. So it was a great session once again. Thank you all of you for joining us on this Sunday morning. This was, we thank Dr. Samiran Das Adhikary as well. Once again, thank you so much. Please do take care of yourself.